Hello and welcome. This is the EuroHealth podcast, where we discuss key healthcare topics of the European Union. My name is Jiří Svoboda, and our guest today is Péter Kéri, President of the Global Alliance of Mental Illness Advocacy Networks Europe, commonly known as GAMIAN-Europe. Mr. Kéri, welcome to EuroHealth podcast.
Hello, everyone. It is my great pleasure to be invited in podcasts like this because for us, for patients, it is absolutely outstanding when we can represent ourselves in front of a broad medium like this.
Thank you so much for these kind words. So our main topic today is patients' advocacy in relation to mental health. But because that's precisely what GAMIAN-Europe is about. But what I was intrigued to find out is that you have a personal connection to this topic because you yourself have been diagnosed with schizophrenia. How did that influence your involvement in the topic? What was your experience like as a patient?
Basically, to clarify things a bit, I had a period of life when I was absolutely not close to mental health illnesses because until 43, I did not have a mental health problem. Usually schizophrenia is diagnosed around 19, early adulthood. I was very unlucky because until 43, everything went in order. So I have a perception having a really fruitful and normal life, and I did not care about mental health at all. I led the company, things like that. And when I was 43, walls around me started to speak. It was not really a nice event. I would not recommend anyone to try it out. But, I face how recovery, how mental health system, how psychiatry, how psychology is around us today. And after having discerned, because today I can say that I do not really have symptoms anymore. I decided to stay with my fellow patients, and I decided to be with them. I decided to understand them. I decided to collaborate with the system as a whole, and to try all stakeholders make understood how we can have a better future in this context.
Was there a particular experience as a patient that really made you say, okay, this is what I want to do now. There is such a big trouble that I want to help trying to solve?
Hungary is very important in this context because in Hungary, in my foundation, because I started my recovery at a foundation called Awakenings Foundation, we use a method called voice hearing method. It is usually not an accepted method in context of psychiatry, but in this context, we try to understand our inner narratives. When you have schizophrenia, for example, you hear voices, but you hear narratives, you hear sentences. And we do not say that it is something, oh, wow. We say that, okay, you have this symptom, why don't we understand that? And I started dealing with that. And in that very moment, I understood that if we do not look at mental health issues in a holistic way, and we do not cooperate with different types of patients, like not separated persons with schizophrenia and borderlines and bipolars and people with depression, but together, then we will not be able to achieve something better. And then we started with self-help groups, with voice hearing groups, for example, in Hungary. However, I must mention that in my country, this voice hearing method is there for nearly 10 years, more than 10 years.
So then comes the era when you joined GAMIAN-Europe. Could you explain more in detail what is the role of GAMIAN-Europe within the space of education about mental health? Because, of course, there are a lot of non-profits, a lot of organizations that are involved in this space. How is GAMIAN different?
I would not say that there are plenty of many non-profits or NGOs in this field, because in pan-European level, it is not easy to see many. In this very moment, GAMIAN-Europe is, I think, one of the biggest pan-European organizations. We have approximately 50 member organizations from all over Europe, what is outstanding. And we have approximately 20, 30, but it's a liquid number, partner organizations, professional partner organizations. And when I add that a person who lived with schizophrenia once, today can be president of a pan-European organization, elected president. And same times, I'm the first person with schizophrenia who can be the board member of European Psychiatric Association and, for example, European Brain Council. Then I think it is easy to understand that it is a change. It is a real change today that we can see. And it is a necessary change, because if you look back in research, in professional writing, in care, in hospital setting, patients' voice were not as deeply listened as today. And I think GAMIAN-Europe did a lot in connection with that. And in this very moment, we are doing a lot to make others realize that listening to patients' voice is something critical, something crucial, and without understanding the real needs and the real inner things that they are handling, we cannot achieve.
So as you say, the center of GAMIAN-Europe's agenda is the patient's involvement in treatments of mental illnesses. Could you more describe what does it mean what does patient-centric approach mean in the context of mental illnesses? How can we imagine it?
It's a great question, and if I could answer in a very straight way, I would be happy. But last weekend we had a board meeting in Brussels. GAMIAN-Europe had its board meeting, and it is a big question because patient involvement is not something that is very straightforward today. It can be very tokenistic sometimes. It means that, for example, many times, research or care settings can say that we involve patients in our care system, but what in depth it means? Do we really understand what they want? Do we really involve them in decision making? Do we consider them as a democratic member of our organization, for example? In countries, for example, it is absolutely self-evident that patients have their boards in an NGO or a care organization. In other countries, it is unacceptable that a patient can have impression or critical voice about the way of treatment methods, or about the articles, or about the television program where they were mentioned. And that's where I think an organization is crucial, like GAMIAN-Europe, to make all the stakeholders understood that, yes, we are here, we understand our suffer, because we are suffering so many times. And if we add this point of view to all the work, what you are doing today, we can have a happier tomorrow together. Because if you look around today, so many questions we have in connection with mental health. Why don't you work? Why can't I help you? What is the root of your illness? It is so ununderstandable for me. And who can answer that? Only patients. And without the inclusion of their voices, this question will stay unanswered. And that's not really good, not really good for the society. Society needs answers.
So when you describe the different problems people with mental illnesses deal with, what are the main areas they face difficulties when they are seeking treatment or when they are trying to just live their lives? You said like work, for instance, may be an issue. What are the other areas that maybe do not even occur to laymen that people with mental illnesses have to deal with?
It is again a huge question. I would underline the stigma. First of all, however, I do not really like this word stigma, because what does this word stigma mean? Or conceptions about being having mental health problems is something very different throughout the world. And me, you, others will have totally different narratives about different mental health conditions. And that is something bad too many times. And when you, for example, first time go to a pharmacy and you ask for an antipsychotic, however, you could be the best, I don't know, friend of this and that person in your village, little village. From that very moment, they will spread the word that he's mad. He's mad, and from this very moment, we will not have a discussion with that person. And it is only one example. And in our daily lives, facing with this tiny little stigmatizing episodes is something absolutely painful. It's something absolutely unbearable. And until that moment, we together with the complementary society, we do not speak out about what are the roots of these stigmatizing narratives inside us until we cannot find solutions for this. And certainly we can mention that workplace reintegration is a big problem today, because with this and that diagnosis, it is not really easy to find a normal job for a person who lives with specific mental health issues. For example, for me, however, I graduated and I lived really a fruitful life. I don't think I will have ever a normal job in the open job market.
I like what you said, that from that moment that a person buys some psychiatric medicines, the discussion is about them, not about them with in the village, not with the patient, right? So that I think that happens probably very often, right?
And it is only one thing. You can go, for example, if you are diagnosed with schizophrenia, and for example, you have a pain in your neck or somewhere, you go to a doctor. In that very moment, they have second thoughts about your illness, because they do not straightforwardly believe that you really have that pain because you are schizophrenic. They think that maybe there is something wrong with you. Is it true that you have that problem or not? And in connection with that, I would mention that the life expectancy of those ones who live with major mental health issues are 10, 15 years shorter compared to the normal population. And the root, if you dig down, we can find the roots of this, because we are underdiagnosed in connection with many other body issues, and we could save lives if we would understand people with these mental health conditions. And it is not only reality for those ones who are diagnosed with mental health issues, but it is valid for the normal society as well. Being underdiagnosed in connection with something can cause shorter life expectancy.
So in terms of more maybe practical issues that arise when patient is seeking care about of his or her mental illness, you mentioned differences across countries, that in some member states of the EU it might be a different situation than in other. Is there a particular state or a country that you would highlight is it needs like a lot of attention when it comes to patients' care and patients' involvement in mental health treatment?
I am not as lucky as you might think. I know different patients, different organizations from lower Europe, and certainly I know different, and GAMIAN-Europe understands different perspectives from patients, but it will not definitely mean that GAMIAN-Europe knows the real differences between real countries. We know differences between organizations. So, for example, I know this and that community care system, and I know the differences between those ones. I know hospital settings in this country and that country, and I know the differences. But we don't have the actual capacity. We don't have the how should I say? We don't have the real view of the real differences. We absolutely know that there are differences, but we are not that organization who can and who will measure these ones in connection with different countries.
So, as you said, one of the biggest issues of patients is stigma. That's of course the big issue. what there is also a thing called self-stigma, right? So when you basically internalize the social prejudices against you as a patient with mental illness, how does it impact individual patients? So like try to maybe explain like how does it influence you as a patient? Yes, how does it affect you as a patient when the stigma is upon you?
I think it can be very personal, because if you have a life background, if you face stigma from nowhere in that very moment, you will be shocked in a second. So when you first will face that you are called mad, it is not really an easy moment. And if it is, for example, a formal friend or actual friend who talks in a different context with you, then you will face that, oh my God, everything changed because of the diagnosis. And that is very hard. And it will cause something different for every person. For example, many of my fellow patients try to do more and more to prove to society that they are better. And it is time consuming, and it is very stressful to make society understood that we are worthy, we are valuable, we are normal. We have just a diagnosis, and for example, we already recovered, but it is not an issue, because if you already have a diagnosis, nobody will consider that you are already cured or you are in normal shape. You have this diagnosis forever, and it is not really an easy task to handle. But it is not easy for families, because if you look at the family where everything was in order after the diagnosis in the family, everybody thinks about that. Who's responsible for that? Everybody tries to figure out that, my son, I did everything well, so what can be the problem? Maybe I did something wrong, and everything in the past is rewritten in 1 second, in 1 hour. And when you look at your own family, and you just acknowledge that it is the time when everything is rewritten. And nothing is true what was true in the past, so it is absolutely cruel, and it is absolutely a sad situation. But that's when psychiatrists, psychologists can help us.
So when you're mentioning stigma as something that's widespread, but I'm thinking, for instance, about my generation, which is maybe millennial or Gen Z. In my friends group, among my peers, I would say like the stigma isn't so grand towards mental health illnesses. Do you think that's the case, or do you see it differently? Do you think there is still a stigma against people with mental illnesses even within the younger generations?
I do not really know. What I know is that today it is very fashionable to look nice, to be great on Facebook, to be absolutely underlined on Instagram, and or mistakes, or I don't know, vulnerabilities are not really there. So I don't think it is something well visible, being fragile today. So if you have mental health issues, I think you are not in the middle of the discussion. When, for example, I start a discussion with my friends, it's a barbecue party. I was open about my problems, and I was once the center of my happenings. Many friends, really good friendships around me, but I thought it will be something brave that I will talk about the issues I had to face. And in that very moment I start to talk about my problems, everything freezes around me. So nobody wants to discuss about this. Even when I speak about some achievement in connection with mental health, for example, I talk about, wow, guys, this and that happened in Europe, and something will be better in Europe in connection with mental health. Party is frozen. Everybody stops talking about this, right. And everybody stops, connections with me. So, it takes a man to understand the way and the how-tos and the know-hows, how to continue friendships and discussions. And I always mention that until we do not have a red Facebook where we can have our problems as well, because today we have only a blue Facebook where we have our very best things, but maybe in the future we will have a red one where we can say we are sad, we have problems. I don't know, my bread is not as nice as the neighbors. Until that moment, we cannot disclose our mental health issues publicly.
Okay, let's talk a bit about comorbidities of mental illnesses, because that's also very interesting in the relation to the fact that you also mentioned it briefly in the beginning. So does the experience of a patient who has mental illness and, say, for instance, cancer or another more, let's say, common disease, does the experience of these patients get worse?
What I would underline in this context, that understanding this long-term illnesses is crucial today because it never happened. Imagine that situation. I was invited by a European organization called EURODIS, the organization of rare diseases, and I did not know that we will have a common ground. And I spoke about mental health issues and, I don't know, family relations in when we have a patient in the family with mental health issues. And it turned out that they live with the same issues. However, they do not have basically mental health problems. They have something bizarre in the family long term, and they must live with that. And, we just figured out that, oh my God, they already invented that wheel I want to invent with GAMIAN-Europe, and it was very nice that these cooperations can create understanding, and these conversations can be very destigmatizing in the future, and all these long-term illnesses can be connected because we learned a lot, and mental health can learn from cancer. Mental health can learn from other chronic illnesses and vice versa.
Well, in one of the previous episodes of this podcast, we spoke with Professor Gabriel Fischer, who we spoke about substance use disorders and in connection to mental health. I assume that must be quite similar, right? Because I've heard the term double stigma, so meaning there is this kind of stigma both for the substance use disorder or for the rare disease and for the mental health illness connected to it. So is that the same with the comorbidities GAMIAN is also interested in?
Yes, absolutely. But I think we should distinguish stigma in many contexts. When I entered to my foundation, first I thought that, for example, mental health patients will not discriminate each other. And I sat next to a lady who had bipolar, and after 5 minutes I hated her, really. And next day I met someone with borderline, and I was just there saying that, oh my God, what I'm doing here in this place? So it will happen like this, that I will meet these girls and guys, and no, I did not want that. So for me, and I'm very empathic today, it took time to understand they suffer. And it took time to understand the reasons and the lifelines and how it is happening. And if you try to, for example, understand addiction and mental health, and stigma in addiction and stigma in mental health, we will see differences. Because until that moment that you go to a electro party and you take a pill and you feel very, very normal, and the next day you do your work in a very nice way, nobody will stigmatize you. Everybody will love you. But in that moment, you do something what is not nice or not in order, everybody will stigmatize you. And it is not like that with mental health, because schizophrenia will be stigmatized whatever you do and however you lived in your previous period of life. So there are differences.
One of the most mentioned comorbidity in the past year is definitely COVID-19 and the pandemic around it. So how are we far in understanding how much COVID did influence the mental health situation in Europe. Is there like particular? Can we, for instance, say that like there is a X number of increase in patients regarding with mental health illnesses because of the or in connection with the pandemic?
Basically, yes. If you look around and if you remember well, I think 100% of population had mental health issues in that very moment because stress was around. So we cannot say that this and that percentage of, I don't know, this and that illness was there. No, 100% of population felt that there is something happening inside our souls. It is one translation, but the other translation for me was that too many times we talked that COVID-19 showed us that there can be a mental health pandemic. But I don't really like this narrative because schizophrenia will never be infectious. Bipolar disorder will be never infectious. And certainly with discussions, with psychosocial, connections, we can prevent to be mentally, how should I say in a nice way, to have mental health problems, but we do not do that. So I think there are connections with COVID. We learned a lot. We understood how easy it is to talk about or suffering when there is something around us. And that should be valid when we are talking about other types of mental health issues like depression, borderline stress.
Right. Well, that's interesting what you say, because I've brought out some numbers here, and it says that like in mental health problems affected around 84 million people just in the EU. That's 1 in 6, and it costs us 4% of yearly GDP in just the European Union. So that's quite drastic, right? And it might be even more now after the pandemic.
And you are saying it costed. That's what I usually criticize. Well, I'm a patient. I cost a lot, maybe. So you just mentioned that we cost this and that amount of money, and I don't think it is really a good perspective, because we don't lose money in connection with mental health. We lose pianists, we lose architects, we lose painters. We lose fantastic persons. We don't lose money. Everybody costs an amount of money in our society, but usually we start amounts when we discuss about mental health.
So let's move to the cooperation within the European region, which is mainly what GAMIAN is all about. So you work a lot on the intersection of politics and healthcare. When you are speaking with policymakers across the European Union, how do they approach usually the topic of mental health? Is there also stigma from their side, or is it now better received as a topic than it was, for instance, several years ago?
They are heroes. I think they are heroes. Talking about, fancy wines or, agriculture is something quite normal. But talking about mental health and talking about persons with sorry to again use the word, schizophrenia or madness, as sometimes they use, it is not as fashionable. And these guys who promise that they will talk about mental health and who promise that they will be involved in this very diverse area of mental health, they can do really something. And when I start, for example, a speech in front of European Parliament, I'm always personal, and I always try to make them understood that it is not really an easy topic. It is not really something, funny, or not something where we will have a nice dinner after, laughing together only, because talking about problems, sorrow, traumas, it is not really easy. That's why I think it is brilliant that there are MEPs who decided to be there to try to understand the mental health situation today in Europe, and I'm absolutely glad that an organization like GAMIAN-Europe can support them if they want that. Certainly, so many times they want it. So many times we are asked to speak about this and that issues in front of interested ones. So that's nice from them.
So what I hear from you saying is that they are understanding, they hear you, they want to hear your voice. Does this understanding and affinity, let's say, translate to concrete policies, concrete legislation, and efforts or initiatives that are happening? Do you think the effort, the awareness, let's say, is being actually translated into like steps in legislative effort?
What I think basically is that certainly not directly. So not this discussion, for example, what we have today will not be on a paper tomorrow, or hopefully not. But or work together on this level, and or discussions with policymakers, with professional organizations, with decision makers. We can enrich with the voice of patients, and the voice of patients can be there today. And around those tables, not only professionals will decide on the house in the future, but they will have a new narrative, what was given by the real sufferers who have problems in their own countries. And it is outstanding because research is research made by professionals are outstanding, but personal lived experience in different countries is something as big and something to be listened, to be understood, and today it is happening. So that's how we can impact, for example, the new narratives and new regulations.
Mm-hmm, mm-hmm. How does that impact look in practice? So, for instance, say you have a policymaker you want to approach and you want to make him maybe familiarize with your agenda. What is the issue you're trying to raise? Like, what are the main thing? What is the main talking point that you get the politician or policymaker interested by to be like, say, proponent of the GAMIAN-Europe's agenda?
I don't think it should work like that, because GAMIAN-Europe is a patient-driven organization. It means that, first of all, I and all my colleagues, we should understand the real voice of patients, and we must go there country by country to understand what is going on, what issues do you live with, and after collecting these issues, we start co-creation, collaboration with partner organizations, for example, and member organizations, and to these discussions we can invite guests from any level and in any country. And what we can see that after they listened to our conversations, after they listened or webinars, workshops, they sometimes change their mind. Right. We can integrate something into their way of thinking, and that is something outstanding.
Right. So GAMIAN supported for several years the interest group called MEP Alliance for Mental Health. But last year there is a novelty since last year in the establishment of European Parliament Intergroup for Mental Health. So this is more of a formal group now. It only established in December, but what is this group about? What do you expect from its agenda?
It's very fresh for us as well. However, we had a really huge history working together with European Parliament, but we are very happy that today we can say that in different parties different MEPs are dedicated to the issue of mental health. And certainly mental health is not only a topic created by patients. It's a topic where plenty of stakeholders can be present. And what we know that we supported this, and what we know that we will continue supporting this cross-party, formation. And I hope we can have more and really more time to have discussions with those ones who are interested in mental health from the patient perspective as well in this intergroup.
Mm-hmm. Is there any particular, again, initiative or legislative effort you wish to bring up within this newly formed group?
What I can say, patient involvement is something important. It itself is very, very important, because patients are not as visible as they could be. And it is sometimes really underestimated that if we include the perception of patients in everything they are connected with, we can have a sustainable and better future, better well-being. We can have better prevention in the future. We can understand mental health issues really in depth. And I think we will fight for that.
Another major development that happened quite recently in the European Parliament is that there was establishment of Committee on Public Health as a standalone committee. So does this mean, in your opinion, that the topics such as mental health will gain now more attention from policymakers? Do you see it already happening, perhaps?
Yes, I think the attention is growing, the attention is understandable, and hopefully that it will direct us to a good way, because attention sometimes is very good, but attention sometimes can be not driven by the real needs of those ones who are affected. And that's why GAMIAN will be always there to communicate what is the best interest of those ones who are there with problems.
Peter Keri, President of GAMIAN-Europe, was the guest of Your Health podcast. Mr. Keri, thanks so much for your time.
Thank you very much. It was my great pleasure. Hopefully we will hear each other.